is Coach Tess from HealthEversity. And today, see, I'm using my green highlighter. Yes, my green highlighter to identify all of my procedures in green. And this is a book that I used to study on when I started studying for my CPC board exam. So I want to share it with you. Okay, a lot of the information, it does not change. A lot of the procedures don't change. A lot of what they've done pretty much have not changed over several years. So we are going to just use my book right here, and you'll see a lot of the mistakes that I've made, so you don't make those mistakes, right? So let's look at some of the terms in here. Look on this word, biofeedback, development of a person's ability to control or his autonomic nervous system. So biofeedback is one of those where you possibly might see it on the test, on that board examination test. You might see that. Okay, catheterization. You will see catheterization in a lot of sections, right? You might see it in, let's say, cardiovascular, digestive, urinary, in the brain, the nerve section. So pay attention to some of these terminologies, right? Chemotherapy, killing of cancer cells by administering neoplastic agents. Why I'm doing the videos like that? Because this is how you study, how you hold the book up, how you can look at it. Use your fingers. Use your fingers to point at it, just like what I'm doing. All right, so let's go down here. Compulsion, repetitive behavior by ritualistic characteristics. So some of it is diagnostic versus what is procedures. All right, debridement. You might see this in integumentary as well as musculoskeletal. So that's a popular term right there. All right. Dialysis. You'll see this a lot in medicine. Hemodialysis as well. Okay, look on these two terms right here. Extracranial, extraspinal, right? Outside of the skull, outside of the spine. All right. Guide training, gastroenterology, study of the stomach, intestines, esophagus, liver, gallbladder, and pancreas. All right, so let's look at this one. All right, so you have hallucination, hydration. That's a popular procedure. A lot of people who have go to the hospital, if they're vomiting, having diarrhea, they do hydration, and they do it by time. So look into your CPT book, hydration. Okay, infusion, injection. So now look at, you have three of them: infusion, aspiration, and injection. Know the difference between these two, right? Injection. So they're inducing fluid into a tissue. Infusion, therapeutic agent induced into the body. Aspiration, which you don't see right here, they're pulling liquid fluid out. So when you're inducing, that means you're putting it in, and this one, aspiration, you're pulling it out. So you have infusion, aspiration, injection. Okay. All right, so let's look at some more. Manipulation, thrusting, measurement, movement to achieve realignment of joint of spine. You are going to see this term in musculoskeletal. Manipulation. Neuropsychology, on call, ordinary ortho, panic attack, paternal nutrition, prosthetic. You're going to see this a lot, right? You might see this in musculoskeletal. You might see this in digestive. You might see this in other areas, okay? But you might see these two, the most on the test here. Psychotherapy, range of motion, reflux, and rehabilitation. So, like I said before, please pay attention to some terms that are very, very close to each other. They look alike, but they're different. Just like when you see aspiration and injection, know the difference, okay? So guess what? Have a good one.